The views expressed in this program do not necessarily reflect those of this station.
Welcome to Insights into Northeast Michigan, a WBKB News public affairs program. Insights deals with the issues affecting those in the community, as well as Northeast Michigan and the state. And now, Insights into Northeast Michigan.
Good morning and welcome to another edition of Insights. I'm your host, Star Connor, and today I have Dr. Karen Meyer. How are you doing?
Good.
Good, and thank you for attending Insights today and talking about World Stroke Day. To me, that is a special issue and topic, and I just wanted to know, why is it important to recognize a stroke right away?
The quicker one gets to the ER and gets medical attention, the better the outcome. It has been shown that people who get to the emergency room within about 3 hours of their stroke have a better overall outcome in disability after 3 months span.
And what are some of the risks or signs, should I say, that someone experiences when they're having a stroke?
The main things that people experience and signs to look for are if they have numbness on one side, weakness on one side, or if their speech has changed, such as garbled or just not making any sense.
Could you tell which side is, I guess, greater? As a doctor, do you see more patients with a stroke on their left or their right side?
Actually, strokes are more common on the left side, but we see really both. So it's not significantly, more on one side than the other. A lot of the time, but there is more of a chance of left-sided stroke, left side of the brain.
And do you know why that is?
If it's the left side of the brain, that's the more common, then it's their right side that would be weak, or their right side that would be affected. So whenever you have a stroke, if it's on the left side, it's going to affect your right side of your body. But if the stroke on the brain is on the right side, it's going to affect the left side of your body.
And what triggers strokes?
Well, there's a lot of risk factors. The most common risk factors are blood pressure. There's a heart arrhythmia called atrial fibrillation that is fairly common. And needs to be looked at when somebody comes in. Other things include obesity and lack of movement, sedentary lifestyle. High blood pressure is a big one, and diabetes as well, and smoking.
And patients here that you see, or some of the patients in the past that you've treated, what would you say triggered their strokes the most, like when you look at their charts or anything that you could tell me?
I would say predominantly atrial fibrillation and hypertension.
Hypertension?
Yeah, I also left out hyperlipidemia, and which then causes, which is linked to atherosclerosis, which is clotting of the arteries, and so that too is also a big aspect. Sometimes there is a familial aspect. There is a higher risk of it after age 65, but really stroke can affect anyone at any age. And it is more common in women, but that might be because the lifespan of women is a little bit longer than men.
Okay. Do you think women carry more of a barrier of stress, or why do you think we see it more in women?
I think it also could be hormonal issues. There's also a higher risk of stroke with birth control pills, and estrogen replacement can increase blood pressure. So all of that is possible.
Oh, okay. And then are strokes related to any other health issues? Like we talked about diabetes, we talked about high blood pressure and stuff like that. Do you think it's more related when you have those health issues build upon each other, or is it more, like you said, the pill aspects, like taking more meds?
I would stick to the typical risk factors, yes. Yes, I think if you have certain diseases that could create a hypercoagulable state, which means that you have an easier chance of having thickened blood. Certain protein deficiencies could create that scenario, but those are not as common. But sticking to the common ones, it's more the diabetes, the obesity, the atherosclerosis, the hypertension, smoking. Those type of things are really the major risk factors.
Are there different types of strokes?
So there's two types of strokes. There's ischemic and hemorrhagic, and with ischemic, you just are not getting the blood supply to the brain, and that can occur from blood clot or from a plaque, from an atherosclerotic plaque. Mm-hmm. And hemorrhagic is basically a bleed in the brain, and but the ischemic type is more common, significantly more common. About 88% of your strokes are going to be ischemic, and so those are the major classifications, and then there's perhaps classifications underneath those. But for our purposes, there's the broad spectrum is there's two.
Well, thank you, Dr. Meyer. We have to take a quick break, but we'll be back with more insights. Welcome back to Insights. I'm your host, Star Connor, and I have Dr. Meyer once again with me, and we're talking about strokes today. And I just want to know, how many strokes patients have you seen here or over time experiencing strokes that you've worked with?
Over the 2-year span that I have been here, I have seen hundreds of stroke patients. And I run the inpatient rehab unit, mm-hmm. So I predominantly see them when they're ready for their care and to move on with the rehab aspect of their care.
Okay, and when you talk about in the rehab aspect of their care, what is the aftermath of a stroke?
Yes, so people will perhaps have issues with language and speech, and they will not have the mobility that they had before, mm-hmm. and they might just not be able to take care of themselves like they used to before, and those are called activities of daily living. So on the rehab unit, it's a team approach, and there's physical therapy, occupational therapy, speech therapy, nursing staff, and myself, and social work that all come together to get this person back home again. And that is our goal.
Right, and when we're talking about goals, what can a person do to prevent having another stroke? You normally see one person with one stroke, but what can we do to help people not have another stroke?
Some people, or most people, will be put on an antiplatelet agent, so aspirin or Plavix, and the other thing they might be placed on is something for high cholesterol, so that can be addressed as well. But also just watching those risk factors again, watching their blood pressure, getting the adequate treatment for that they need from their doctor, and watching their weight, watching their blood sugars with diabetes, and make sure they stop smoking. That's a big one, actually, for me.
Now, you as a rehab doctor, mm-hmm. What's one of your favorite, positive things or positive things you'd like to do with a patient that has had a stroke?
The best part of my position is being the leader of this team, mm-hmm. Of this team approach that I think is just so integral. The people get about 3 hours a day of rehab, and it can be pretty intense, but I always tell the patients that this time, whether it be 10 days or 14 days or what have you, is their time to really focus on their ability to get better and to not worry about what's going on at home and what's going on with the family, but really just focus on the time that they have to get better. And just seeing that daily progress, even though it might be small, is really exciting. And then also just to see them as a stroke patient initially, but leave here as a person who just happens to have a stroke, and they're learning how to better deal with the situation is exciting.
Now, of course, Sunday today is World Stroke Day. What can we do to educate people more, you yourself as a doctor, to educate people of the awareness of strokes?
Well, I want to thank you today for having me on so that I can educate people with what segment you're doing today is fantastic. However, we could do better. I've seen billboards in the community as giving us the signs of stroke up on a billboard so people can get educated that way. But I do think that even a support group type situation would be helpful for the community. And so we can continue to work on that. Literature, flyers. There's wellness programs oftentimes from employers, and I know Mid-Michigan has wellness aspects connected to our being employees, and so all that is important in cutting down risk factors.
Now, encouraging your patients, how do you talk to them, just to keep them positive after they have a stroke?
You just have to be very upfront. You have to know how hard this is for them. We do consult psychology if we need to work with the depression aspects that kind of come from the change in lifestyle that they've just endured. And basically you just have to be very positive and also educate them as to how you think their prognosis will be, and then also just bring in the family and encourage all of the family support as well.
Do you see a lot of support from family members?
Yes. That is something that on the rehab unit we are lucky to be involved with because their success sometimes is based on the family involvement, and so sometimes we just see phenomenal families come together and work to get the patient home.
All right, and speaking of the rehab unit, I'm excited. We're going to actually get to see that, correct?
Yeah.
All right, okay.
Yeah, I'll come show you the unit here.
All right. Welcome back to Insights. I'm your host, Star Connor, and again I have Dr. Meyer, and we've been talking about strokes this morning, and I want to ask you, what are some new technologies you see here at Mid-Michigan and all over when it comes to strokes? What are some new technologies y'all are using?
Since we are a rural community, the hospital has a new program coming up soon where they are going to incorporate telemedicine into the stroke care of the patient. And so we will have access to neurology and neurosurgery remotely so that we can consult those physicians right away, and they will be from Mid-Michigan, perhaps University of Michigan.
Okay, and talking about neurology and neurologists, there's a team when it comes to a patient having a stroke. What are the team players that help the person come?
Yes. Well, beyond just the rehab, which is the end result, when they first come into the hospital, they're being seen by the ER team, and so that will include the ER doctor and nursing staff there, and perhaps neurology or neurosurgery. Then if they come to the ICU, then they're going to have a hospitalist see them on the ICU, and nursing staff on the ICU, and then incorporate neurology if they stay here. A lot of times if they have a bleed, they might have to be transferred to another hospital that has a neurosurgeon because we don't have one on staff. So then after that, they might be transferred to the acute care bed, and there they're going to have nursing staff, and case management might come into play to see where the best place for them to have rehab would be, whether it be in home sometimes, whether it be in a subacute facility, which could be like a nursing home situation, or here on our rehab unit. And so then after that, then if they do come to the rehab unit, then we have our whole team that I discussed earlier with PT, OT, speech therapy, myself and social work and nursing staff.
You mentioned ICU. How many ICU units does Michigan Alpena actually have to help a person with a stroke?
We have one ICU for adult patients, and that is a 9 ICU bed unit.
Okay, and then with the rehab part, where your favorite part is,
Yeah.
Besides the unit, what else in the hospital is positive and good for a person that's, coming back after they have a stroke?
Well, we have 11 bed unit here. And so then we have our gym downstairs, which I will show you, where they actually have their rehab in the inpatient rehab unit. So if you're on the floor, like the acute floor, you will typically not go down to the gym. It's pretty much reserved for our acute inpatient rehab patients.
Okay.
And so I can show that to you.
All right, let's take a walk and go see the gym.
Okay.
Inside here, I see a lot of equipment. So what actually goes on inside?
Yeah, this is our inpatient rehab gym, and it's a very nice size gym, and the therapists will work with their gaits. They're walking, so they have a lot of room for which they can improve in their gait. And these are the stairs here for which they can practice and train them how to negotiate stairs.
Okay.
And we do work with endurance, so this is a new step machine that helps with their, if they're debilitated, they can improve their endurance. And then over there we have a life-size bathtub so that they can practice on how to get in and out of the bathroom and a bathtub.
Okay, and going back to treating a patient with a stroke, how many hospital beds does Mid-Michigan Alpena have? Is there any limit to treating for?
They have about 127 beds, and there really isn't any limit as to how many stroke patients we can have at any point in time.
Okay, and talking about outpatient therapy, I know there's inpatient therapy we see,
Yes.
but
Yes.
there's life after a stroke.
This gym, it would be very similar to what you would see in an outpatient setting. And so after people would be discharged from inpatient rehab, then they might have either in-home therapy for a while, or they might be prescribed outpatient physical therapy for which they would go maybe 2 times or 3 times a week and continue with working on their mobility and continue working on perhaps speech aspects if they needed speech therapy, or OT, working on their activities of daily living.
So Dr. Meyer, when it comes to a stroke, is there a increase or decrease when it comes to a racial group?
Well, first of all, the amount of strokes has reduced in the last 30 years significantly, about cut in half, probably because of the treatment of hypertension better than prior. But there still is an increased incident of stroke in the Hispanic and African American populations.
And I just wanted to reiterate and wanting to keep the community healthy. What again is some risk factors that everyone can watch out for, or some things they can do in the community to make sure they're making sure their bodies are healthy and preventing strokes?
Well, the main things are diet control, keeping their blood pressure down in a normal range, their blood sugars under control, weights. The obesity issues are quite high even in the entire United States, and so watching diet and weight control, that type of thing. Again, smoking, big issue, and they need to try to cease that. I find that people do pretty well once they're in the hospital because they can't smoke when they're here, and they stop smoking, but sometimes they get back into the habit again, and I just encourage people to, once you stop, just keep it going.
Well, I don't want to stop. I want to continue, but I think that's all the time we have for insights. But I would like to thank you so much for your insights on strokes. And until next time, I'm your host, Star Connor, and tune in next week for more insights.
Insights into Northeast Michigan is produced by WBKB News. If you have any comments, suggestions, or topics you would like to see on a future show, please email WBKB News. This has been a production of Thunder Bay Broadcasting Corporation. All rights reserved.